Welcome to Health and Wellness. I'm your host, Kearni Warren, and today we're speaking with Kristin Beltz, who is an occupational therapist at Moss Rehab, which is part of the Einstein Healthcare Network in Philadelphia, Pennsylvania. Today, Kristin and I will discuss stroke recovery and rehabilitation. Thank you so very much for taking time to speak with us today. Beginning, I would like to start off with, what is occupational therapy?
Okay. As an occupational therapist, I think of occupation in a broader sense of the term. So occupation meaning anything you would do to occupy your time. So when the term was actually invented, it was during a time where when you thought of occupation, it was thinking about activities that you did, anything that you did during the day to occupy your time. It's not necessarily how we interpret it now as occupation meaning a job. So as an occupational therapist, my training specifically is in activity analysis and looking at someone's activity pattern or what they need to do for their daily activities, and being able to really look at each segment of that, breaking it down into parts and figuring out the type of treatment I would use to address the deficits they have that are preventing them from participating in those activities.
So what are some of the common effects that you see with a stroke survivor coming into your office?
Okay. Stroke and affects the brain. So anything that your brain controls can be affected by a stroke. So a stroke presentation could be somebody that has purely cognitive deficits, difficulty with memory, problem solving, reasoning, that type of thing. It could be somebody that's purely a speech problem, that they are unable to communicate their needs the way they did before. It could be somebody who has purely a motoric issue where they might have weakness or paralysis on one side of the body. It could be a presentation that happens just that you're noticing weakness in a leg or just in an arm, or it can be a combination of any of those or all of those. So any individual person that comes in with a stroke, you don't necessarily know what you're going to see in that initial meeting with that client, but it could be any of those, and we try to look at that from an activity basis. What are they not able to do at this point, and how can I get them to return to those activities that they wanted to do?
So when dealing with rehabilitation, is time an important factor in the level of recovery?
Time is one of the most important factors actually when you're dealing with a stroke. So getting that initial treatment when you're recognizing symptoms from a stroke is one of the highest predictive prognostication types of things for recovery. So the quicker you get that initial treatment for a stroke, the better your outcome is going to be. Following that, within that first time period, usually they kind of talk to a 3 to 6 month time period, initially right after you've had a stroke. And during that time period, as your body has gotten over that initial assault, what happens is there's initially, after you have a stroke, there's an area of the brain where there are certain cells that are actually dead. There's cell death. But surrounding that area, there's cells in there that may have been harmed but not completely incapacitated. So initially after you have a stroke, it's important to have very intensive rehab in those first few months after a stroke, because your body is actually producing chemicals and proteins in your brain that help to speed up that recovery and help drive neuroplastic change in the brain. So during that time period, you want skilled services where they can see those subtle changes and help to try to progress people to the next level. So that time period where your brain is just kind of really in that mode of trying to reorganize is very crucial to having therapy, and which is why that time period for inpatient rehab is so intense. You have therapy 5 to 7 days a week, 3 or more hours a day. Initially, when I had first started working, it was thought that the brain was kind of set, and what you had after you had a stroke was kind of what you were going to kind of stuck with, and you just have to learn to adapt to those deficits. What the research is showing now is that your brain can continue to heal years past. It's just the difference being is that first 3 to 6 months, the rate of recovery is so much quicker. Following that, you have potential for recovery. The rate is just a little bit slower.
What are some of the devices or equipment that you use here at Moss to assist with the recovery process?
Some of the products that I use pretty regularly are the SableFlex, the Sable mobile arm support, some of the things we have here in the clinic. And those devices are used to help to retrain functional reaching, functional grasp and release, and in context of an activity.
Okay, well, let's take a look at some of the products that you just spoke about, and we'll give a demonstration to our viewers on how the products are used.
Wonderful. That'd be great.
Talk to us about
The release splint?
the release splint and the therapist who created it.
Okay. There's a therapist on staff here at Moss Rehab. He also works in outpatient occupational therapy. Was working with individuals with stroke and found that as much as there were products out there, different splinting options, that he wanted to find something that can be used in everyday activities. So while some of the devices that we talk about today, like the Sabo stretch, a regular resting splint, those types of things, you're not necessarily used in context of your daily activities. Some can be used as a trainer or something that's something you would use for exercise, but he designed this specifically to be used all day in all of your activities. It's similar in the concept that a lot of people following a stroke have that flexion piece where they can bring their hands and fingers together but don't have the release component. And this actually is called the release splint. And what it does is, if you can get that flexion to be able to hold something and relax the tone in your hand, that piece there will help to extend your fingers.
I'm sitting here with Gary, who has attended the inpatient therapy at Moss, and now he's attending outpatient therapy, and he's a client of Kristin. Kristin, can you talk to us about the type of therapy and movements that you see and provide for Gary?
Sure. Okay, Gary, so one of the things that we're talking about today is just how the different technologies that we have here at Moss are helpful in the recovery process after stroke. So I think a good way to do that would be just to kind of demonstrate the type of movement that you have without any assistance, and then we can show how the different technologies kind of help in your recovery process. So I think the first thing I would like to do is I just would like to see kind of how are you able to reach your arm out straight in front of you?
Yes.
So let's see, so you want to lift your arm, you want to reach, straighten your hand forward. So if you could just squeeze your hand really tight, okay, and now I want you to try and open your fingers. Okay, so what you can see there is he has a lot of that increased tightness in the fingers that make it really hard, that even if we were doing any kind of functional exercise program, there's not a goal to it because he can't use his hand very effectively.
Gary, how long ago did you have your stroke?
About 2 years.
2 years, okay. And you've been coming consistently to stroke here at Moss?
Okay, so
even from the beginning, I went to Moss Rehab.
Okay.
So what we're going to kind of show then, I guess, is just how some of the technologies that we're talking about could help. So we're going to try the SableFlex. And again, this is useful to help retrain that pattern of grasp and release.
And this is called the
SableFlex. So for therapy, he comes twice a week, and then we try to emulate that even in the maintenance program. So he'll continue with the program that we do with the assistance of an aide or a family member, but he'll be able to use the equipment that we have here to keep continuing with his program. Since we talked about the further out you get from the initial incident of stroke, the recovery is a little bit slower. So he can continue to work on those exercises even if there's not insurance coverage that is possible for that.
And is this yours, Gary?
This is his.
Oh,
Yes.
okay. So you're able to go home and practice like Kristin said.
Yes.
Okay.
So with the mobile arm support, it just gives him a lot more range of motion and mobility to be able to work those muscle groups that in isolation or on his own are a little bit more difficult to do. So in this position, you can see his hand is no longer in like it was originally, where his fingers, the spring helps to pull his fingers back and get his hand in a more functional position. And in this way, if I was to ask him to grab something, and then you're going to pretend we're going to drop it in the basket over there. So if you can let it go, that spring, as he learns to control that increased tone and tightness in the flexors, the springs help to assist and give some of that release.
There's a lot of wonderful services here at Moss that are stroke specific. That's an amazing, plays an amazing role in stroke recovery. How would someone find out more about Moss Rehab and the program specifically for stroke?
You can go to our website at www.mossrehab.com, and there's a stroke link that you can click on, and you can find information about any of the programs specific to Moss and stroke recovery at that site.
Well, thank you.
You're welcome.
I'm Kearni Warren, again, your host for Health and Wellness. Thank you for watching. For more information, definitely go to the website for Moss Rehab to learn more about stroke rehabilitation and recovery.